Welcome to This Explainer. Today, we're investigating a fascinating yet honestly terrifying medical mystery. Imagine the life-giving water inside your aquarium literally turning against your goldfish. It's an invisible killer that strikes without warning. But don't worry, by the end of our time together today, you're going to know exactly what gas bubble disease is, the wild physics behind it, and most importantly, how to treat it.
You know how human scuba divers can get the bends if they resurface too quickly? Well, can a goldfish get the bends? Surprisingly, yes. They can experience a remarkably similar and deadly phenomenon called gas bubble disease or gas bubble trauma. When the water they swim in becomes completely saturated with excess gases, like nitrogen or oxygen, those gases literally have nowhere else to go but straight into the fish's bloodstream and tissues. Okay, let's really dive into this. What makes gas bubble disease so incredibly unique is that it isn't caused by a virus. It's not a bacteria or a parasite. Actually, it's a technopathy. That essentially means it's an environmental trauma completely triggered by our own aquarium equipment. The very life support systems we plug into the wall to keep our ecosystems thriving can inadvertently trigger a lethal thermodynamic shift. Crazy, right? So let's move into section 1, the physics of supersaturation. Let's break down exactly how this disaster unfolds mechanically. Picture the life cycle of a bubble. The most common culprit in a home aquarium is just a simple air leak on the suction side of a water pump or a canister filter. If there's even a tiny pinprick hole in the hosing or maybe a loose O-ring, the pump creates a vacuum and sucks in a tiny stream of air. Inside the pump's impeller chamber, the high pressure violently forces that air into a dissolved state. We call this the Venturi effect. So when this mixture is discharged back into your tank at a lower pressure, the water is now dangerously supersaturated. If you listen closely to your filter right now and hear a faint hissing sound, that might be exactly what's happening. But wait, equipment failure isn't the only cause. Enter the winter water change. The physics here are actually pretty simple. Cold water can hold a lot more dissolved gas than warm water. During the winter, tap water coming from those underground pipes is freezing and super gas-rich. If you do a massive water change and rapidly heat that cold water inside your tank, the thermodynamics suddenly shift. As the water warms up, it loses its ability to hold all that gas. Those dissolved gases are literally forced to precipitate out of the solution, turning into physical bubbles right inside your poor fish's delicate tissues. So the absolutely crucial point here is knowing when a mild imbalance turns into a full-blown crisis. If the total gas pressure, or TGP, reaches around 103 to 105%, it can cause chronic, slow issues. But if that TGP exceeds 115%, no way. That thermodynamic instability creates an acute, lethal, and immediate medical emergency. Which brings us to section 2, spotting champagne bubbles. If this thermodynamic shift happens, time is literally of the essence. Before you even see physical bubbles, you're going to see behavioral shifts. Early on, your goldfish might act skittish, restless, or you might see their fins trembling. They might start piping, which is when they gulp right at the water's surface. But the most dramatic early indicator, positive buoyancy. As gas literally builds up in their GI tract or swim bladder, they lose the ability to stay neutral in the water. They'll involuntarily float up to the surface, struggling violently to swim downward or even drifting completely upside down. As the disease progresses, the physical signs become, well, pretty unmistakable and honestly grotesque. You'll start to see clear, silvery, crackling bubbles trapped right under the skin on their head. You'll often spot what looks exactly like little champagne bubbles embedded in the fins. Another major red flag is exophthalmos. That's severe, bulging eyes, caused by the gas pressure building up behind the eye globe itself. Now, diagnosing this in fancy goldfish varieties is uniquely tricky. I mean, think about it. If you own a telescope goldfish, their eyes naturally protrude. If you own a bubble eye goldfish, they literally have natural fluid-filled sacs under their eyes. You have to be incredibly observant. You've got to carefully distinguish a healthy, symmetrical, clear fluid sac from the asymmetrical swelling, internal hemorrhaging, and tiny silver gas pockets caused by gas trauma. Basically, if a telescope's eye suddenly swells way beyond its normal baseline and you see blood in the eye, that is a massive red flag. And you know, what's happening on the outside is just a mirror of the absolute devastation happening on the inside. If a vet took a microscopic gill biopsy, they'd see these empty caverns displacing tissue right inside the blood vessels. These microbubbles act as emboli. They stick together and physically block the blood flow in the gill capillaries. That means the fish's heart and brain are literally starving for oxygen, causing rapid tissue death. All right, let's get into section 3, emergency treatment protocols. If you spot these symptoms, you must act right away. Because this is a technopathy, your very first priority is to fix the environment, not just the fish. Step 1. Find and turn off that leaky pump or filter causing the Venturi effect. Step 2. You've got to gas off the water. Throw in some vigorous aeration. Use coarse air stones or surface agitators to break that surface tension so the excess trapped gases can escape into the atmosphere. Step 3 is actually a really cool physics trick. If you have a deep pond or can temporarily move the fish to deeper water, do it. The increased hydrostatic pressure down deep actually compresses the bubbles that are already trapped inside their bodies, giving them immediate relief.
Now, commercial hatcheries and huge aquaculture facilities, they use high-tech, total dissolved gas sensors to constantly monitor pressure and prevent these spikes from ever happening. But us home aquarists rarely have that kind of expensive gear, so we have to rely completely on visual vigilance, watching our fish's behavior closely and sticking to a really strict routine maintenance schedule for all our plumbing and O-rings. But what if the environmental fix just isn't enough? Well then, it becomes a serious medical situation. For severe cases, an aquatic vet will actually perform needle aspiration. They carefully pierce the visible bubbles to manually pull the trapped air out. But because those expanding bubbles tear delicate tissue, secondary bacterial infections are almost a guarantee. To fight that, the standard protocol involves a systemic antibiotic, like Canaplex. Finally, dosing the water with Epsom salt provides osmotic support, which helps draw out that severe internal swelling. You're also definitely going to want to move your recovering patient to a dedicated hospital tank. Keep this isolation tank meticulously clean and precisely heated to right around 80 degrees Fahrenheit or 25 to 27 degrees Celsius. That specific warm temperature is the absolute sweet spot for a goldfish's metabolism. It lets their immune system fire on all cylinders while those damaged blood vessels attempt to heal up. Gas bubble trauma is a pretty startling reminder, isn't it? Keeping goldfish healthy isn't just about sprinkling food and doing water changes. It's completely tied to the raw physical properties of their environment. As aquarium keepers, we're basically managing a super delicate, pressurized thermodynamic balance right in the middle of our living rooms. So I'll leave you with this question. What steps will you take today to ensure the life support systems you plug in don't silently turn into an invisible killer?